Hello everyone, Dr. Marissa Baca here from Straith Clinic, and today we're going to talk about carpal tunnel syndrome. Now, carpal tunnel syndrome is a problem with a pinched nerve in the hand that affects many people. Sometimes it has to do with other medical problems that you might have. Sometimes it has to do with overuse of the hands. Sometimes it just happens for no good reason. But either way, the nerve that runs through your carpal tunnel that gives sensation or your ability to feel in your thumb, your index finger, your long finger, and half of your ring finger is affected. So these areas tend to feel numb. Now, sometimes you notice it with certain activities, such as driving, talking on the phone, brushing your hair, or most commonly at night when people are often in a situation where the wrist is bent, and that's putting more pressure on the nerve. Sometimes these symptoms are intermittent, meaning they come and go. Sometimes they're constant. And usually, if they are constant, it means that the pinched nerve or the amount of disease has progressed more. And it's certainly time to go see a hand surgeon to evaluate the problem. Now, your carpal tunnel itself is at the wrist, and it's made up of your wrist bones on the back and then a tight ligament over top. Through the carpal tunnel travels several tendons as well as the median nerve, and this is the nerve that's responsible for the symptoms. It gets tight in that carpal tunnel, and that pinching of the nerve results in the symptoms that you feel of numbness and tingling. There is also a nerve that powers some of the motor to your thumb in that area, and that can be affected in severe cases. Now, treatment for carpal tunnel ranges from simple things like activity modification to wearing a splint or a brace at night, or doing activities where normally the wrist would be bent and the symptoms would be exacerbated. So the splint helps keep the wrist in a more neutral position to help decrease the symptoms. If symptoms progress enough, sometimes surgery is the appropriate answer, releasing that tight ligament that's creating the pressure in that carpal tunnel so that the nerve doesn't have that pinched effect anymore and can start to repair itself and to start to resolve the symptoms. If you have any questions about these or other procedures, please call Straith Clinic today.